Good afternoon, everyone. In this very brief video, I'm going to be answering a common question we are often asked. Some women and some men want to know their chances of fertility when they eventually get married, and some of them actually come to the hospital to get tested. So in this video, I'm going to be answering this question briefly. For us, we start assessing for infertility after 1 year of regular unprotected sexual intercourse. And regular intercourse for us is 3 to 4 times a week. So if after 1 year of doing this, there's no conception, we start to assess. There are exceptions to this 1 year cutoff though. Another issue is that for infertility, there are contributing factors. Male factor, that is problems or concerns about the male, the female, and then we have combined factors contributing to the burden of infertility, and we also have the unexplained infertility. So when one person, maybe the female, is coming to assess chances of conception without assessing the male partner, it becomes difficult. And also for the male, there are what we try to assess is the seminal fluid, which also contains the sperm cells. So that's what we assess for the male. But for the females, the whole build up to fertility starts from the brain, from an organ called the hypothalamus, and from there to the pituitary gland, to the ovaries, to the fallopian tubes, and then the uterus. So to assess the female, we go through these organs, and in some situations, an organ like the thyroid gland can have a bearing on female fertility. So in some situations, we assess that too. Some of these tests are, simple, straightforward. Some others are what we call invasive. Example, there's a test called laparoscopy. So it's invasive because you may have to be taken to the theater, placed under anesthesia for the examination. So there's a whole spectrum there. So when a patient wants to know, when you want to know if you can do any tests for fertility, some people just say, oh, I've done an ultrasound scan and it was fine. The ultrasound scan is not an exhaustive test for female factor fertility. So there's a whole gamut of tests, and with different degrees of invasiveness. So when you want to do a test for fertility, are you really willing to go through all the gamut of tests there is to really ascertain fertility? And then secondly, if you go through all those tests and get a clean sheet, in quotes, for all those tests, everything is normal, it doesn't still account for unexplained infertility. So, what I mean by that is, one can have a clean sheet, have all the gamut of tests normal, but still be unable to get pregnant. So essentially, I just made this video to say 2 things. Number one, when you want to do a full fertility workup, there's a lot involved and not just an ultrasound scan. And number two, if one goes through the whole gamut of tests, it may not cover the area of unexplained infertility, so it may give a false sense of security, if I would call it that. So the next time, but I mean, if you want to still go ahead to have the test, it's okay, but then be sure that all these factors are in place. Thank you.